Hello and welcome. Today, we're diving into a common yet serious heart condition, heart failure with reduced ejection fraction, often abbreviated as HFrEF. This condition, formerly known as systolic heart failure, impacts millions worldwide. Understanding HFrEF is crucial for both patients and their loved ones, and that's what we're here to do: break it down and explore its complexities. So, what causes FrEF? Well, the heart isn't failing for no reason. The most common culprit is coronary artery disease, where narrowed arteries restrict blood flow to the heart muscle, leading to damage. Other frequent causes include prior heart attacks, high blood pressure that's been uncontrolled for a long time, certain heart valve problems, viral infections that damage the heart, and even excessive alcohol or drug use. In some cases, genetic factors can play a role, making certain individuals more susceptible to developing HFrEF. Now, let's get a little technical. In HFrEF, the heart's left ventricle, the main pumping chamber, weakens and enlarges. This prevents it from contracting forcefully enough to push out a normal amount of blood with each beat. This ejection fraction, which is the percentage of blood ejected with each contraction, is reduced, typically below 40%. Because the heart can't pump efficiently, blood backs up, increasing pressure in the heart and lungs. This leads to fluid buildup and impacts the body's ability to get the oxygen and nutrients it needs. HFrEF is a significant public health concern. It's estimated that millions of people in the United States alone are living with heart failure, and roughly half of those have the HFrEF type. The prevalence increases with age, making it more common in older adults. It also disproportionately affects certain populations, with a higher prevalence observed in African Americans compared to Caucasians. Understanding these trends helps us focus on preventative measures and targeted interventions. The signs and symptoms of HFrEF can vary from mild to severe, depending on the stage of the condition. Shortness of breath, especially with exertion or when lying down, is a hallmark symptom. Swelling in the ankles, legs, and abdomen, known as edema, is another common sign. Patients may also experience persistent fatigue, rapid or irregular heartbeat, persistent cough or wheezing, weight gain from fluid retention, and a lack of appetite. It's important to note that these symptoms can sometimes mimic other conditions, so a proper diagnosis is essential. Diagnosing HFrEF involves a combination of physical examination, medical history review, and diagnostic tests. A doctor will listen to the heart and lungs for abnormal sounds. An echocardiogram, which uses sound waves to create an image of the heart, is crucial to assess the ejection fraction and heart structure. Other tests may include an electrocardiogram (ECG) to check the heart's electrical activity, blood tests to measure certain enzymes and hormones, and a chest X-ray to look for fluid buildup in the lungs. Sometimes, more advanced imaging such as an MRI may be required. While we're focusing on HFrEF, it's important to briefly mention the other main type of heart failure with preserved ejection fraction, or HPF. In HPF, the heart muscle is stiff and doesn't relax properly, preventing it from filling with enough blood, even though the ejection fraction may be normal or near normal. The treatments for HFrEF and HPF can differ, which highlights the importance of accurate diagnosis. There are other classifications of heart failure based on the New York Heart Association Functional Classification, an NYA class, which describes the limitations to daily activities. The cornerstone of HFrEF treatment is medication. Several classes of drugs are used to manage symptoms and improve heart function. These include AC inhibitors or ARBs, beta blockers, diuretics to reduce fluid overload, and newer medications like ARNIs, SGLT2 inhibitors, and mineralocorticoid receptor antagonists. Lifestyle modifications are also critical, including a low-sodium diet, regular exercise as tolerated, weight management, and smoking cessation. In more severe cases, implantable devices like pacemakers or defibrillators may be necessary. For advanced heart failure, a heart transplant might be considered. While there's no guaranteed way to prevent HFrEF, adopting a heart-healthy lifestyle can significantly reduce your risk. This includes maintaining a healthy weight, eating a balanced diet low in saturated and trans fats, exercising regularly, managing blood pressure and cholesterol levels, avoiding smoking, and limiting alcohol consumption. Early detection and treatment of conditions like high blood pressure, coronary artery disease, and diabetes are also crucial for preventing the progression to heart failure. The prognosis for HFrEF can vary depending on the severity of the condition, the underlying cause, and the individual's overall health. While HFrEF can be a life-limiting condition, advancements in treatment have significantly improved survival rates and quality of life. Recent research focuses on personalized medicine, exploring genetic markers and biomarkers to tailor treatments to individual patients. New therapies targeting specific mechanisms of heart failure are also being developed, offering hope for even better outcomes in the future. For example, Newer drugs are being created to target fibrosis and inflammation. Gene therapy also shows promise. By understanding the condition, adhering to treatment plans, and staying informed about the latest research, individuals with HFrEF can live longer, healthier, and more fulfilling lives. Thank you for watching.